I'm Julie Miller from Healthcare Improvement Scotland's Community Care and Dementia portfolio, and I'd like to welcome you to this Power of Attorney question and answer session. We organised this as a companion session to the recording of our Power of Attorney webinar that we held on the 13th of December. And we had so many people joining that session and we were overwhelmed with questions. I didn't quite have time to answer them all. So we've arranged this session so that we can address all those outstanding questions. So I'm delighted to be joined by our speakers from that session again. So we have Jill Carson, Public Policy Consultant with Alzheimer Scotland, and we have Jim Brown, who's a development worker with Carers of West Lothian, and Dr. Vivek Pattan, Consultant in Psychiatry of Old Age in NHS Forth Valley. So hello to you all and thank you for coming back to answer all the outstanding questions. So for this session, we've divided the themes into, the questions into 5 themes. So we have setting up power of attorney and practical considerations. We have a wee bit about the cost, assessing capacity and the role of the person who has a power of attorney, and some questions relating to guardianship. So without further ado, let's move on to answer the questions. So our first theme on setting up power of attorney, I'm going to pose this question to you, Jill, and obviously others can come in if you feel you've got anything to add from Jill's answer. So is there a guide for the sorts of questions or topics around finances and health that an individual should consider and discuss with their attorney when drafting up a power of attorney document?
So what I would suggest is that it is useful to look at some resources because it will help to inform your thinking. Now, if you go to the Office of the Public Guardian website, you won't actually find that guide to the questions that you might be thinking around or the topics that you might want to put in, because it has a framework but not the detail of that. So there's a couple of sources that you can use. There is the Code of Practice that sits alongside the Adults with Incapacity Act. There's a Code of Practice for attorneys and guardians, and you can access that through the Scottish Government website. And that will certainly give you some ideas on the kinds of areas that you should be thinking about or could be thinking about. The other resource that I'd like to mention is a book that came out in 2021, and it was written by Sandra MacDonald, who was formerly the Public Guardian for Scotland. So she absolutely knows inside out what she's talking about. And the book is called Power of Attorney, the One-Stop Guide. And you can find that on, well, you can look it up probably on the internet, is the easiest way. But again, in that it's very comprehensive, and you'll find a guide to the sorts of topics, things that you might want to think about and include in your document. But if it's more around the structure, how to frame the document, then you'll certainly get that on the Office of Public Guardian site.
Thank you, Jill. And I should have said at the beginning, any guidance or resources that we mentioned throughout this webinar, we'll have those attached to the recording at the end. So thank you. I don't know if Jill or if Jim or Vivek have anything to add to that, or if we're all right to move on to our next question. Okay. Okay, thank you. So, I suppose, Jill, that's around the person themselves setting up a power of attorney, but what about a guide? Is there any guidance for actually being a power of attorney? If you're appointed a power of attorney, what guidance is there for that?
Again, I would suggest Sandra MacDonald's book is excellent for clearly setting out what your roles and responsibilities are as an attorney, and also for helping you to think through whether it's something that you're able to undertake, that you have the skills to undertake, because it isn't for everyone. You do have to have some kind of understanding of your role, your responsibilities. Perhaps some assertiveness is often required when you're dealing with financial and health systems to actually advocate on behalf of the person. So that's a very helpful resource and has certainly added to what's available out there to support you in your role as attorney.
Okay, thank you very much, Jill.
Just to add, I think, I mean, the Public Guardian's Office has a very good sort of frequently asked questions area. So that will give a lot of answers. So that's a very good resource, if you want to quickly go and have a look at, what should the power of attorney holder should do, and the code of practice, etc.
Okay, thanks very much. And the next question is related to the presentation that you gave, Jim, at the webinar in December, and it's around you have a special sort of service from Carers of West Lothian where you support people to set up a power of attorney, and so there's a couple of questions around that where people were saying, do all health and social care partnerships have the same carer support set up with people in hospital? Are you able to say anything about that, Jim?
Yes, I don't think everybody has exactly the same as we do, but most of the carer centres will have some sort of activity within the hospitals, whether it's based within the social work team or based within the hospital team. I think we're kind of unique in that we go to the medical ward MDT meetings, and we can pick up people at an early stage then. And I also attend the daily flow meeting for the integrated discharge hub. But I know that in other places, the question basically was relating to Glasgow and Lanarkshire. Glasgow Carer Centre have a relationship with the Govan Law Centre.
Okay.
And if they make a referral to the Govan Law Centre, there is no charge for a power of attorney being drawn up. And in Lanarkshire, they have a relationship. Lanarkshire Carer Centre have a relationship with a firm of solicitors, and a referral from them gets the grantor a 15% discount in the cost of power of attorney. But I think each individual, I know Edinburgh, I know Vocal Carer Centre have a relationship as well with certain solicitors. So it's just a case of finding the number in your local carer centre and finding out what they have.
Yeah, okay, thanks very much, Jim. And I should mention too that we now have the impact story about your the West Lothian Carer Centre and the work you do on the web pages relating to the Power of Attorney webinar. So if people want to maybe try and replicate what you do, there's a great impact story there for them to be inspired by. So thank you, Jim. And this next
other
one.
Areas, so Julie, so just add in other areas. I mean, it's good that West Lothian has done this sort of a bit of work. I think it's very important piece of work to facilitate discharges and move from the hospital. So people can access the Power of Attorney campaign. It runs occasionally, once or twice a year, or publicity, so they can access that. And also, I think Solicitor for Older Adults, we're not related, but I think they also run some campaigns on Power of Attorney in areas where this sort of a setup is not available.
Thank you, Vivek, for adding that. Okay, and the next one I think is back to you, Jill. And someone was saying, if it is required to have either power of attorney or guardianship, why is it not a legal requirement that people either apply for power of attorney or state that they will require guardianship?
Well, it's an interesting question, isn't it? Why is it not a legal requirement? Well, it's not in the law that you have to do it, I suppose, is the first thing. It is something that is recommended that you do it to protect your rights, and also to make sure that you are having the choice of who is acting for you. But the issue around about guardianship isn't applied for until there is a question that needs answering, if you like, until there is an issue that arises. And then it's at that point that guardianship is applied for. So it doesn't actually, it's not something you can do in advance. And I guess in a sense, it becomes a legal requirement at that point, because you at that point, when you're at the point of not being able to make decisions for yourself and you haven't legally appointed anyone, then it is in fact a legal requirement that someone is appointed legally to do that. As to why you don't have to have a power of attorney, I'm sure the answer to that is far more complex than I have time to go into right now. But I think it's important to recognise that it is something you do of your own volition. And if you don't do it, if you don't put it in place, then you are taking that risk, aren't you, that actually you won't get into that situation of losing capacity at any time in your future, and therefore you won't need to think about that. But that's what you're weighing up. It is your choice, however.
Thank you. And then again, staying with you, Jill, someone else was asking, if you decide to allow an attorney to act on your behalf for finances, can you still manage your own finances as well?
I think that the answer to that is probably in theory, yes. However, we do know that it can be quite complex when you are being an attorney for someone in the financial world with the banks. It doesn't always go straightforwardly and smoothly. And it's probably easier if you are going to appoint your attorney to act for you, that is what you do, and then you interact with the banks through your attorney. And if it's something that you want to chop and change with, and you want to do it sometimes but not at others, you might be better taking another route rather than an attorney. So for example, you might be able to do a third party mandate. So you basically write to the bank and say, I hereby authorise, like you might do on the phone if you're speaking to someone, you might say, I authorise my husband or son to speak on my behalf here, and then whoever you're speaking to will speak to the other person, but they can't do that unless you authorise it. So it's a bit like that. It's just giving someone authorisation, but on a more kind of temporary basis.
Yeah. Okay. Thank you. Anything to add, anyone, for that one? Okay. Thank you. And yes, sorry, Jill, we're putting you through your paces. The next one is to you again, and obviously, Jim or Vivek, add anything afterwards. What if someone with capacity has no one they can appoint as a power of attorney? What do they do? Does it mean they have to wait for guardianship?
Well, they can't, in that sense, wait, because power of attorney is something you do voluntarily. So if you have no one that you have close to you that you can appoint, bear in mind that you can appoint anybody who's willing to act for you. It doesn't need to be a relative, it could be a friend. Then usually you'll find that someone, for example, a lawyer would be willing, a professional would take that role on for you. And in some countries, the system of supporting people is through professional attorneys and not through a more family and friends type of approach. So it can be that you can find someone who will professionally act for you. Obviously, that's a bit of a different relationship. Then you would write into your power of attorney that the person would be entitled to payment for that, I would think. But in terms of waiting for guardianship, as I mentioned, guardianship only comes into play when you're at that point of losing capacity. So you do need to be clear that you're making that choice. If you decide not to appoint someone, then it will come down to, if you get to that point, there will be a guardian required.
Yeah, I think this applies to guardianship orders also. Solicitors, if they don't have anybody, some of the solicitors will be willing to take on guardianships, mostly financial guardianships. And there are few solicitors who will take on the welfare. Again, it's a chargeable basis.
Yeah.
Thank you. Okay, to move on. Okay, so thank you. That's that first theme. So the second theme, and this was very, very popular topic at the webinar, was around cost. And we did spend a wee bit of time, I think, talking about the cost, but I think it was so popular that we've kept it in to ask again in this session. So, and again, this is for Jill and Jim, if you have anything to add. Can you explain the potential costs involved and if there are exemptions or sources of financial support that people can access to make this process easier?
Okay, so I think you're right, Julie. We did cover this at the time. It does vary depending on whether you use a solicitor or whether you don't. If you do it yourself, you're still likely to have a cost to get someone to certify the power of attorney document, be that a doctor or a lawyer. But there may well be a cost associated with that. And again, that's very variable. It's not set anywhere as to what could be charged for that. I'm not sure I want to even say what might be a typical sum, because that might be a difficult place to go. But if you're talking solicitors' costs, you're probably not far off the mark, thinking around about the £300 mark. You also have a cost to register the power of attorney. That's currently sitting at £83. In terms of financial support, you can get financial support if you're on certain benefits. The rules around that are very complex, and it will depend not just on how much money you're bringing in, how much you're earning, but also on capital that you have. But it is complex. It varies according to things that you might not think, like age. And if you are entitled to support for setting up the power of attorney, for the cost for setting it up, then you will have to go through a solicitor, because it is a solicitor who makes that assessment. So you can't avoid using a solicitor in that regard. You have to go along, and you have to go along first and be assessed for that before you'll actually know. There is a calculator that can help you on the Scottish Legal Aid Board website, so you can go to that and use their calculator. You have to answer a few questions, and it will give you an indication of whether you will be eligible with the costs, which can be helpful so that you know in advance before you consult a solicitor. It's not the easiest thing to use, I will say, but it's there. You can also ask the Office of the Public Guardian for help with the costs of registering the power of attorney. Again, there are rules round about that, but the Office of the Public Guardian are very helpful in that, and you can always give them a phone and ask if you would be entitled, and they will support you through that.
Thank you, Jill. Jim, have you got anything to add? I know your scheme manages to do it a wee bit cheaper with the arrangement that you have.
Yeah, we certainly have. We basically go down a discounted rate that the solicitors offer, and that seems to suit the people in our county that are quite happy to accept that. We, as Jill was saying, we point people in the direction of the eligibility estimator as well with the Scottish Legal Aid Board, and it gives them an idea. The question about means tested benefits does probably mean that you are likely to qualify, but obviously your capital and savings would have to be also taken into account. But it's a good indicator that unless you have got savings, that you probably will qualify fully for power of attorney. It does get a little bit complicated, so in our terms, the carers were quite happy just to take the discounted rate. It does make quite a difference to them, but the prices that Jill were quoting is fairly common, 300 in West Lothian, between 300 and 600. So 197 is quite a saving for the carers in their organisation.
Thank you, Jim. And just same with you, Jim. Someone had asked in the Q&A, what if someone just can't afford to set up a power of attorney?
Yeah, we have in the past, if we get donations or if we get specific funding, we will try and allocate some of that towards carers who either we fully pay the power of attorney, or if we can contribute, say, we will pay the registration fee, then we will, but it really just depends on funding. I'm not quite sure where they would go. I think Jill's answer about contacting the OPG about possible reductions in the registration, but I'm afraid I don't know a clear answer to that one.
It's a tricky one.
Yeah, I would imagine if they can't afford, then they would probably be eligible for legal aid and probably end up getting it for nothing anyway. But
yeah, okay, thanks, Jim.
If I could just add to that, Julie, I think it's a really valid question, particularly given the situation that we're all in at the moment, with the challenges in living prices going up, etc. And in some ways, it's not just about affordability, is it? But it's about the choices that you make in terms of what you want to put your money to. And it is harder, there's no question, for people to be thinking, well, I want to allocate some money to that just in case scenario, when actually I'm struggling with my here and now. So it certainly is a challenge, I think, and it's a challenge to get people to be really thinking about putting money towards something like that at this point in time.
Yeah.
So there isn't an answer, as Jim said, but it's a challenging question.
Yeah. Thank you. And then over to you, Vivek. So at the webinar, using power of attorney stationery, you know, where people can download forms by themselves or buy them privately, I think was mentioned. Can you say a wee bit more about this, about actually people downloading the forms themselves?
I mean, this was more about, I mean, ideally, you know, the power of attorney should be individualized. So, you know, if you go to solicitor, they'll be able to, you know, look into a particular circumstances, either welfare or financial, and draw up, you know, based on your needs. But, you know, if you don't have access or you're not able to afford, I mean, you know, doing something is better than nothing. So we can go to any sort of website, any shops, I think, you know, WH Smith or Works, anything, or even Amazon. So, you know, if you just Google power of attorney documents, I mean, you might be able to get some standardized forms. I mean, you can use that, and then, you know, if you are able, you can tailor your own power of attorneys. You know, using that, it's not necessary that you should go to a solicitor to, you know, do the power of attorney. You know, you will be able to do that yourself.
My concern with that, Julie, my concern has always been that there's an element of solicitors having to keep up to date with the latest human rights laws, and I always feel that a solicitor's power of attorney is a little bit more future-proofed. And unfortunately, if your power of attorney doesn't contain the powers that you want, by the time you find that out, when you're trying to invoke it, it's maybe too late to do another one. The capacity is maybe gone for the grantor. So that's why we always advocate going through the solicitor rather than, and as we mentioned earlier, sometimes there's a charge to a capacity assessment letter, or it's sometimes almost as cheap to go to the solicitor as
Okay, thanks for that point. Yeah, thanks, Jim. Okay, so we're now on to the next theme, and this was a very popular theme for questions, and that was around the complicated area of assessing capacity. And again, there's a question about guidance. So it's asking, is there any guidance that states who should assess in the first instance? And this is for you, Vivek, because this person who posed this question was saying they have seen some problems where there can be disagreement about who should assess capacity.
There are two things I think. So the question is, you know, who can look into, you know, whether somebody can grant power of attorney. So if that is a question, I think it, you know, I would say the first port of call would be the solicitor who you would go to. Then there are other, you know, professionals like doctors, you know, primary care doctors, or, you know, consultant psychiatrists who can also look into the, you know, whether somebody can grant power of attorney if the situation is slightly complex. But the first port of call would be the solicitor, you know, who might be able to, you know, make a judgment about whether somebody can grant power of attorney. The other question is, you know, incapacity, whether somebody lacks capacity. So that's in a very different area. In that there are, you know, specific guidances on, you know, who can assess this incapacity. So that's usually a doctor or a health professional who is trained in that particular incapacity assessment. That's very minimum at the moment. You have to go through a, you know, course to do that. Then there are, you know, optometrists and you know, other dentists who can do the incapacity, but again, very specific areas. But generally, a doctor would be and a consultant psychiatrist would be the person, I think, who can do the incapacity assessment if it is in a complex area.
Okay, thank you, Vivek. And again, someone else was saying a difficult thing that they've came across in both acute and community settings is situational capacity, and that is where the person might be able to make medical decisions but not social decisions. I don't know, Jill, have you got anything to say about that point?
Yeah, so we did cover on the webinar the notion that capacity is decision specific, and the presumption should always be that the person has capacity to make the decision until or unless you find that isn't the case. So you have to bear in mind all those principles in the AWI Act around about whether the person can understand the decision to be made, whether they can remember the decision that they're making, and so on. And that's quite clearly laid out. And that has to be done in relation to each individual decision. And therefore, it is perfectly feasible that you can make a decision about something and not make a decision about something else. And it's not always as easy as you can make simple decisions, but not complex, because it might depend on your past experience. So, for example, if you're making a decision about taking medication, you might have long years of taking medication, and that familiarity and that understanding about why you're taking medication that you might retain. So you might be able to make that decision, but you might not be able to make a decision in an area which is less familiar to you. So it is difficult, and we do tend to talk about it in an all or nothing way, but it is very much something that should be and needs to be assessed on an individual decision basis. And you shouldn't be making the assumption that just because someone cannot make a particular decision, that that is an overall blanket presumption of incapacity.
Julie, I think just to add, I think, the way the incapacity and, things like PoA are set up, I mean, you can see there is a financial and welfare, and then there's medical treatment decisions. So they're all very different areas. Generally, I think complex, financial decisions are something which goes first, and, welfare decision, like, what would you like, for dressing, food, etc. So these are things I think people can still make decisions till, in an advanced stage of, let's say, for example, the dementia. Again, I think just because the person is in the hospital, it doesn't mean that they can't make a decision about going home or getting care package, etc. But they might struggle to make a decision about complex, medical procedure and operation. So each thing has to be assessed, on its own merit.
Yeah. Okay, thank you, Vivek. And the next one is kind of relating to costs again, and where someone was asking, is it unusual for people to be asked to pay privately for a capacity assessment? I think I was posing that one to you, Jim.
To be honest, that was the whole reason that we started looking to get a relationship with a solicitor. It was, I can't speak for the rest of the country, but in West Lothian, it was quite common to be charged £80 to £100 for a letter of capacity. So by the time you paid your £83 registration fee, and this was at a time when we were actually getting it done cheaper than the 197 that we are just now, it was considerably cheaper to go to a solicitor and get it done. And for the other reasons I said about, making sure that it's future proofed, we would always recommend it. But it was quite a common at that time. But I don't have the same problems now. I don't hear the same number of carers contacting us to say they were being charged, but I'm sure the practice still goes on.
No varies, yeah. Thanks, Jim.
Just to add, I think I would say it's not unusual. So if the decision is not directly linked to your health care, the GPs or even the doctor, or it could be psychiatrists, they would say, it is out with their the usual sort of work practice. It has to be done privately, so they might very well charge, but it depends on individual person. In other circumstances, the person hospital, etc., linked to the healthcare. Lots of doctors assess the capacity and would be happy to work with the person and the family.
Yeah, thank you, Vivek. And the next one is still with you, Vivek. It's do you anticipate that the mental health law review will impact on capacity assessments?
The capacity issue was discussed in the mental health law. Again, I think it might be a bit too big for this session. I think I would say watch the space because lots of decisions haven't been made. I think at one point they were looking at can we simplify the guardianship process, because there's another question somewhere within the discussion we are looking at. I think the time frame. I mean, guardianships can take anywhere from 6 months to 2 years, so it's quite a lengthy time. So the new mental health law is looking at that, or even changing how we look at the law itself. But I think it's a big topic on its own. So I think we'll not be able to cover in this.
Yeah, thank you. I don't know if anyone's got anything to add to that one. It's a complex one. The link to the mental health review, the Scott review, as it's called, is in the webinar recording resources. So if anybody wants to read a wee bit more about the mental health law review, please have a look at those. Okay, so the next question is still with you, Vivek. Have you had to work with a decision-specific screening tool to assist with assessment of capacity?
So various health boards are looking at decision-making, decision-specific screening tools to help. I think it's mostly for patients who kind of stuck in the hospital. I think lots of time even the health professionals struggle to make a capacity or incapacity decisions on how to go about and what to ask. So to help health professionals and people who are involved, we are developing decision-making tools. Through the secondary care and even in the primary care in the GP practices, general practitioners. So hopefully we will try and roll this out nationally and get lots of people up to speed in terms of making the decisions on incapacity. But it's not something which is very commonly used.
Okay, great. Thank you, Vivek. And again, same with you, Vivek. Someone, I think, well, presuming it's an occupational therapist, had asked if occupational therapists are involved in the process of capacity assessments at all.
They're not directly, involved in that. Again, if they have to assess the capacity and make a decision, they need to go through the training course. But there are very valuable, folk and personnel who can assist in somebody's capacity, so they can assess the functioning and how somebody can perform. And in Affordability, what we are using is a simulation of the home environment before somebody gets discharged, rather than making an assumption. We actually get the person to go and stay in a discharge flat, as it were, to go and see whether they can manage the risks on with the support from cares, etc. So OTs are, occupational therapists are quite useful in that situation. So sometimes the decisions are not very easy. Sometimes the incapacity assessment actually becomes a risk assessment. So, we shouldn't be conflating risk assessment to the incapacity and deem somebody as lacking capacities, but they, either remain in hospital or go to care home. So to avoid that, I think OTs are, quite helpful, people to include in your assessment. So if you got access to them, by all means, include them and get an assessment of person's capability and functioning, and then you'd be in a better position to assess somebody's capacity to make those specific decisions.
Yeah. Thank you, Vivek. Yep, that makes perfect sense. And also, Vivek, what evidence is required that someone has been assessed as not having capacity for welfare power of attorney to become active?
Again, I think incapacity, I think there's a group of professionals like doctors, dentists, trained nurses. So they'd have to, person would have come in contact with these folk and they have assessed capacity and made a decision that the person lacks capacity. So at that point, the incapacity or power of attorney becomes active. Don't think, you could inform the public guardians of it. I don't think they expect you to inform, but once it is active, you can start to use that. If you do need, you can use a letter from the professional. Do you want to add anything to that?
Yes, thanks, Vivek. I think it's important to realise that there isn't a button that is pressed that says this is active now. So when it certainly cannot be activated unless it is registered with the Office of the Public Guardian, but there isn't a flag on it that says this is now active. And that's because, as we've been saying, it only comes into play when you're incapable of making a particular decision, but you may be able to make other decisions. So it's not an all or nothing thing. It's not a switch on, switch off with a flag kind of thing. When it is required, it should be utilised. When it's not required, it shouldn't be utilised. So there isn't that thing about active. That said, what you will find is that within your power of attorney, you will be saying how you wish your capacity to be assessed. And there may be instances, for example, where you may well put in your document that you want your capacity to be assessed through your responsible medical practitioner, your GP or your consultant. And if that is in there, then you may find that you do need a letter or something formal. For example, if your bank might ask for that as proof that your attorney should be acting for you. But I think it's really important to realise that there isn't a flag that says this is now active. It is very much around those individual decisions.
Start, I think, Jill, to that. So if you are going to be specific about who should assess your capacity, just be pragmatic about the current situation. I did get a few requests asking me to go and assess capacity. It will add to the delay thing if you are going to ask a consultant psychiatrist to go and assess your capacity. Any doctor should be able to assess somebody's capacity. If it is not, highly complex, and if it is complex, the GPs would request us to, go and get involved, and we'll be quite happy to do that.
Thank you. So we're now on to the next theme, which is around the role of the power of attorney. We had quite a few questions about that. And this is for you, Jill. So should there be more rigorous checks in place to ensure the powers are carried out in the best interests of the person?
Well, again, an interesting question. The whole point of appointing an attorney is that as an individual, you are picking someone that you trust, and that is your own volition, it's your own will to do that. And you are doing that at a point in time when you're fully aware of what you're doing. So in that regard, you are entrusting that significant other person to carry out this role for you, and that is, if you like, the checks. That said, if there are concerns, if the person isn't acting well for you and others are aware of that, then they can always go to the public guardian and raise concerns, and the public guardian can ask the local authority to investigate any concerns. So there is a kind of check and balance there, if you like. It's much less formal than guardianship, where there is a much more formal, if you like, relationship with the Office of the Public Guardian in terms of reporting. So it is very much about understanding that you are yourself appointing this person because that's someone that you trust to be able to carry out that role for you.
Yeah, thank you, Jill. And back to you, Vivek. If someone stated that they don't want to go into a care home, however, now their safety is significantly compromised by staying in the community, are power of attorney, the person who's the power of attorney, able to overrule this?
I think we kind of covered that in the webinar. I think power of attorney only has a certain level of powers. I think you won't be able to force somebody to do things they don't want to do on their volition. So it's it won't, the powers don't extend to the to the decision of getting somebody to the care home and keeping them in the care home in a locked facility. If that is the situation, I think the next option is to go for a guardianship. Again, I think taking medication, just because you have got power of attorney, if the person refuses, you can't actually force the person to take these medications. But there are situations, I think, where you can have a multidisciplinary team discussion that these medications are important and the person lacks capacity. You talk to the pharmacist, the doctor, GP, etc., and you can look at medication using the covered medication pathway with the help of an incapacity certificate under Section 47.
Thank you. And Jill, you've maybe already mentioned this is just one about banks again, but it was just that someone was asking, are there issues with banks recognising power of attorney?
Yes, and I think we probably mentioned this in the webinar as well. There shouldn't be, but there can be. And sometimes when you're acting as an attorney for someone, you do have to be quite assertive. You also will benefit by having all the paperwork to hand so that you can actually show the correct certified copies to the bank, and that should smooth things. Sometimes it's not always easy. And I think someone's made a comment there about recognising an attorney that's been done in England and Scotland or vice versa. And actually there is no formal process for that. Some countries have signed up to something which is called the Hague Convention, which does allow recognition of a power of attorney that is made in one country to be recognised in another country that's signed up. Now, Scotland has signed up to that, but England is not. And in practice, in any case, it probably makes sense if you are in that situation and you or your person that you're attorney for moves into another jurisdiction. I have seen the best advice being to redo your power of attorney document under your jurisdiction in which you're living, and it just avoids getting into any kind of difficult situations. If it is related to anything that gets a bit more complex, or any decisions to be made where there perhaps isn't agreement on the decision, then it's likely to end up in the courts anyway in that situation. So yeah, it isn't just as straightforward as, for example, making your power of attorney document in Scotland and then deciding to move to England and assuming that it will flow with you and will still be applicable down there. You might need to work at that.
Certainly the other way around. Sorry, Vivek. I was saying certainly the other way around. I know the Office of the Public Guardian will issue a certificate of recognition, but you have to apply for that in writing or email. But they will do it. Then obviously your issue then is if you try to do one under Scottish law, is a person's capacity still there, and you have those. So probably getting the registration certificate, the recognition certificate first would be your first step, I would have thought. Try.
Thanks, Jim. Yeah, thank you.
Vivek,
Vivek, did you?
The legislation around incapacity is slightly different in England, so it just throws up lots of hurdles. It's a lot easier, I think, if Jim was saying, recognition certificate through the public guardian's office, slightly easier, I think, for somebody from England, transferring those powers here. But it is difficult to transfer that across to England. Actually, has Jim.
Okay, thank you, Vivek. So we're now on to our last theme, which is about guardianship. I know we've mentioned that throughout this session, but we've got some specific questions around that. And this one's for you, Vivek. Do patients in hospital who don't have a power of attorney need to then wait for guardianship to be in place before being discharged? And if they do need guardianship, how long does this process usually take?
I think Jill covered some of this, I think, in her talk. So it depends on the circumstances. So there is a sub-provision, something called 13ZA, where the multidisciplinary team, everybody agrees that this is in the best interest of the person to go to care of, including that person, if he or she wishes, expresses the willingness that, they would be happy to go, or in the other ways, Jill, correct me if I'm wrong, that if they do not oppose the move, they could be moved under 13ZA. Again, they should not be, wanting to go out or seeking exit from the care facility. But if that is not the case, if there are disagreements and the person doesn't want, and then at present there are no other options other than waiting for a guardianship in the hospital bed. It could take anywhere from 6 months to 2 years, and the maximum I heard is 2 years. So it can be quite a lengthy time for somebody to be stuck in a sort of a clinical environment. So that's why I think the emphasis on do it in advance, get your power of attorney sorted before we reach that stage.
Yep. And I think we covered this at the webinar too, but it was just to quickly ask, who can take on the role of guardian? This person was asking, is it always appointed to a professional within social care, or can family members be appointed as a guardian? And that was for you again, Vivek or Jill.
Jill, go ahead.
Thank you.
Yeah, thanks. I think it's important to say that the local authority doesn't really always want to be appointed guardian. It is their statutory duty if there is no one else, but the first port of call is really to get someone who is closer to the person and can understand the person's wishes. And that would be your ideal. It's obviously your ideal when you're appointing your attorney is to have someone you know and trust and who knows you. And it's no different really for guardianship. So you would only look to having a professional, a social worker, if there wasn't someone who would be prepared or have the skills to do it within the family. I think for yourself, you just got to put yourself in this position and think, if I couldn't make those decisions for myself, who would I want to do this for me? Would I want my son who understands me and knows me well, or would I want the social worker? And I think most people know how they would answer that. So you would prefer it to be a family member, and certainly local authorities prefer when it's a family member.
Yeah, and I suppose related to that and related to the earlier questions about power of attorney, you know, someone was saying it sounds like quite an undertaking to become a guardian, and you know, would somebody be able to guide them through the guardianship process? Would that be the Office of Public Guardian again?
Goes through the solicitor, so your solicitor should be able to help you through the process of guardianship. It is a complex undertaking. You would come in contact with various professionals. There are a lot of checks and balances for guardianship. The mental health officer, social worker, they go through in a review of various folk involved. But your solicitor should be able to guide you through the whole process, so it won't be you undertaking the whole thing all by yourself.
Thank you, Vivek. And we're on to the last question, which is still with you, Vivek, and again, it's relating to cost. So it says here that guardianship is much more expensive, isn't it? What if people cannot afford this? Should the need arise for guardianship?
I think Jill sort of covered this. I think, I mean, it is again, related to the legal aid. So, you go through the legal aid process. If you're eligible, it's free of cost. But I mean, even getting the legal aid can take quite a lengthy time. So it all adds to the delay. But if you're not eligible for legal aid, you would have to pay for that.
Yeah.
Unless there are other options. I'm not aware of any sort of places who would be able to do that on a pro bono or free basis.
Okay. Thanks very much, Vivek. So that was the end of the questions.
I think just to add, I think, I mean, if there's, I have seen occasions where, the guardianship, and because there's nobody around, I think, occasionally local authorities are taken on the guardianship process and paid for those, but they're not. It's not a common, expected thing.
So that's us came to the end of the questions. I don't know if anyone else wants to have any final words for our audience.
I mean, I hope, I mean, we have covered all the questions in the webinar and in this Q&A. I mean, there will be other questions which we may not have picked up or covered. There are lots of questions coming up, I think, especially with the new Mental Health Act, which is looking at enabled decision making. So it's completely changing the way we would make decisions and how we enable a person based on the human rights. It might make the things more complicated, or it might make it easier, but we won't be able to predict how it would turn out, but hopefully for the better. But what we could all do is as I said, I mean try and get the power of attorney done at the earliest. Go to your solicitor the next tomorrow and get it done for yourself and advocate for your family. And there are campaigns happening all the time. If you're lucky to live in West Lothian, you could approach Jim, I think. So,
yeah. Thanks very much. That's a great point to end on, Vivek. So yeah, thanks again, Jill and Jim and Vivek for doing this for us. And if anyone has any other queries about the webinar or the Q&A session, please email us at his.focusondementia@nhs.scot. But thank you again for all your expertise. Bye for now.
Bye.
Thanks, Julie.